Hi, my name is Courtney Karr, and I'm going to talk about different types of stress: acute stress, episodic stress, and chronic stress. How to handle stress like a dog. If you can't eat it or play with it, then pee on it and walk away. Author unknown. However, I would not recommend to do that. Acute stress. Acute stress is the most common form of stress. It can be thrilling, for example, skiing down a slope. Some other examples would be running late to class or work, trying to get your homework turned in on time, or getting a flat tire. It's short term but happens all the time. Some symptoms would be anger, depression, anxiety, headache, heartburn, acid stomach, your blood pressure would rise, or you have rapid heartbeat. It's highly treatable. Some treatment methods would be medication, anti-anxiety medication, or antidepressants, or you could do therapy. Some ways to cope with it would be deep breathing, thinking of something funny just to keep your mind off of it, or chanting. According to the article, the moderating role of positive and negative effects on the relationship between perceived social support and stress is college students by Civic ASIM. College students face all sorts of acute stress, like personally, socially, academically, economically, and so forth. Of course, the best way to deal with stress is social support. Another type of stress is episodic stress. People who experience acute stress over and over again is when it turns into episodic stress. People with episodic stress seem to always be in a hurry or late. If something can go wrong, it does. Some examples would be losing a job and developing health problems, forgetting to do your homework and then having a test that day. Some symptoms would be persistent headaches, migraines, chest pain. Treatment usually requires professional help that can take over 3 months. It's treatable, but it's just a little bit harder to treat. Some coping methods would be deep breathing, don't take more than you can handle, relax, or get some professional help. According to the article, The Impact of Stress on Academic Success in College Students by Murph Sharon. Non-specific response of the body to any demands made upon it. In other words, as demands are made on an individual or as situations arise, the body attempts to adjust or adapt to the situation in order to reestablish normalcy. Chronic stress. Chronic stress is a type of stress that wears people down, day after day, year after year. It destroys people's lives, bodies, and minds. It's a long-term stress that isn't good at all and is hard to stop. People have chronic stress when they can't find a way out of a miserable situation. Chronic stress can cause anxiety and depression. Some examples would be stress from poverty, dysfunctional families, being trapped in an unhappy marriage or job or a career. Some symptoms will be anxiety, depression, headache, abdominal pain, lack of sleep, back pain, and difficulty concentrating. Treatment can require extended medical help, behavioral treatment, and even stress management. It's one of the hardest ones to treat, but it's still treatable. Some coping methods would be deep breathing, meditating or relaxing, keeping yourself distracted. Social support group is a very big help. Even physical exercise, just going out sometimes, maybe 5 minutes a day or something, can easily help. Chronic stress is the most stressful kind of stress and hardest to treat. According to the article, Good Health by Stress and Anxiety, there are often known triggers that raise stress levels and make it more difficult to manage. If you know what the triggers are, you can anticipate them and practice calming yourself beforehand, or even find ways of removing the trigger. Some examples of triggers are late nights, deadlines, seeing particular people, or even hunger. All of this information is important to know, especially when you deal with stress all the time. 3 types of stress are acute stress, which is short-term but happens all the time. Episodic stress is like acute stress, but more serious. And chronic stress is very serious, and I hope it's very serious and most serious. Stress is very serious, and I hope you will take it seriously and make sure you don't overstress. Does anybody have any questions? This concludes my presentation. Thank you.